Hello, and welcome to the Black Doctoral Network's web series entitled Conversation Starters. I am your host, Trayvon Robinson, and we have two guests joining us this evening to discuss achieving health equity in preventive services. Our first guest is Dr. Jacqueline M Harrison. As the president and CEO of J.M. Harrison Consulting, LLC, Dr. Harrison is tasked with providing public health education concerning community health improvements through health equity, the reduction of human trafficking, intimate partner violence, and infectious diseases. She believes that together we can work to change the narrative about what human trafficking looks like, understand the effects of lifelong damage done to victims, and reduce the negative health outcomes associated, such as PTSD, chronic diseases, and the stigma of HIV and AIDS. I welcome you, Dr. Harrison.
Thank you. I'm glad to be here.
Our next guest is Dr. Willie Cobb. Dr. Cobb has been motivating, inspiring, and healing individuals and communities since the 1980s as a teenager on the south side of Chicago. From bringing together youth groups from across the South Side to speaking before thousands at conferences across the country, Dr. Cobb has worked to break down walls and build bridges between different races, ages, genders, and ethnic groups. Welcome, Dr. Cobb.
Thank you very much. I appreciate that.
Yeah. And before we begin our conversation, we just want to remind our viewers and listeners to please, as our guests are sharing their intellectual property, please give them their proper credit for their contributions. All right, let's go ahead and begin this conversation. Our first question is for Dr. Harrison. And our first question is, how important is health equity in preventive services?
Health equity to me means there are a multitude of issues affecting health equity in preventative services today. For the safety and the good of our families, our communities, and the nation, we have to continue to have the equity conversation with providers and stakeholders. There's a worldview, it is changing. Geographically and demographically, there are concerns, and they have been created based on logistics for individuals to receive necessary preventative services. I'm going to give you just a few pointers. These services include provider counseling, the implementation of services by providers, various screenings, and the dispensing of preventative medications.
Great, thank you. Now I will pass the same question off to you, Dr. Cobb. How important is health equity in preventive services?
Health equity just saved my life. When we're talking about health equity, we're talking about dispensing the right amount of services to people all across the spectrum of medicine. So what does that look like? COVID almost killed me. And so when I got COVID, I was 400 pounds. So I recently lost 135 pounds. I have quality health care. My healthcare company gave me the right amount of services. I got tremendous service from my healthcare provider. I have so many services, it's ridiculous. They call me on a regular basis. I get counseling, I got weight loss services, I got the right type of medicine, I got doctors, I got nurses, I got nurse practitioners, I got an enormous amount of services delivered to me. So much so that I was able to lose 135 pounds in 8 months. That's healthcare equity. When we get the right amount of services delivered to the right amount of people at the right amount of time, that's what can happen. Equity delivered no matter what race, creed, or color you are brings the right amount of services to people and people get healed. So when we talk about equity, we talk about people's lives being saved. That's what we're talking about doing. Saving lives. This isn't a joke. We want to bring services to people who need it, the right amount of services at the right time.
Great, thank you, Dr. Cobb. The next question we'll move forward is for Dr. Harrison. How has the current socio-political climate influenced preventive services?
Okay, I'm here in Florida, and it just appears that everything is up in arms. The socio-political climate here, the relationships are formed between coalitions and stakeholders, and those stakeholders have the power to regulate healthcare infrastructures, insurance systems, and policymakers. I'm a former healthcare regulation person, which means that I was an officer working with the licensed providers, as well as an investigator looking at healthcare fraud or different issues that were happening to patients. They would get in touch with me if they felt that the doctor had misused their power or had done something to their family member. And a lot of times, based on the information they provided for me, I was able to gather documents, look at the medical records, try to make a firsthand decision as the initial case manager. Sometimes it went up a little higher, and as an investigator, sometimes I was able to get healthcare delivery as far as regulation was concerned looked at on the micro level. However, the climate is shifting. There were laws and rules put in place and regulations, and sometimes it appears that those rules and regulations are being upheld for certain populations and not upheld for others. Even the healthcare providers were talking to me, and they were saying, based on our that fact that we're African American or whatever, if I look at the fines and costs and laws and rules for my other counterpart, they didn't get the same punishment that I got, doc. And so those kind of things create problems and issues when we're trying to help the public, and as Dr. Cobb has said, save these people's lives, because it covers a multitude of issues. But politics creates a lot of problems, and it needs to be removed from healthcare altogether.
Thank you for your
That's right.
response.
This question relates directly to the last question. We are in a dangerous political time. People have drawn their lines and have gone into their corners. One of the reasons why we don't have health care equity right now is because politics is so divisive that nobody's talking to one another. It's more extreme right now than it has ever been almost in American history. We're close to another political civil war. Look at what happened yesterday with the abortion issue. And so look at what the Supreme Court is about to do. Look at what they're planning on doing. And so we are really close to some very serious issues. So you have people extreme on the right and people far extreme on the left. And so communication has broken down in a lot of areas. And who's hurting? The people in the middle. And that looks like people of color, African American people, poor people are going to be hurting the most. And so we need to galvanize people to have those people in the middle to be listened to the most. They're the one that's going to be hurting over this. The wealthy people, the people with resources, the people who don't have the political voices, they're going to be hurting over this. And so we need those people to have a voice, those people to be listened to. We are in extreme times. People climbing over walls and screaming for their political voices. The only people who are going to be hurting are those people who don't have the resources, somebody to lobby for them. That's the only thing that's going to be happening right now. We need to find the voices for the people who are voiceless.
Absolutely.
Yes, wonderful contribution, Dr. Cobb. Yeah, I think now is a great time for that platform for, you know, underrepresented populations to be able to, you know, have their voices be lifted and heard, and, you know, as you've mentioned before, have, you know, their lives saved, because it's important to, you know, include those who have previously been, you know, voiceless in these spaces. So I definitely agree with both of your contributions there. Our next question here, I will have for Dr. Cobb. What are some of the challenges in the provision of equitable preventive healthcare services?
Part of the problem, and this is going to sound really strange, is our own history. We have a history of not getting services, so we don't know how to access those services. So we're so used to barriers being there, we don't know how to knock down walls anymore. We need to relearn how to use the power that we have. We forgot that power speaks truth to power. I once wrote an article like that. Power has to speak truth to power. If you don't have power, you can't change things. So some of the barriers are ourselves. We forget that we have a voice to change things. And so, if you don't mind, let me give you some examples. All of my life, I was severely, morbidly obese. Come to find out, I had a physical problem. It wasn't my fault. And I have told my family members what this problem was, and it looks like it's a family problem, but they don't want to listen. So we get so used to how things are, we sometimes don't want to change. We have to look at what we're doing that maybe we need to change sometimes to see that we need to knock down our own barriers, to look over, to jump over our own barriers and our own changes. Maybe we can get out of our own way sometimes. And then we can help fix some of the changes in the infrastructure in society. Yes, there are societal problems. Yes, there are problems from state to state. State governments have problems. There are rules and regulations that are just ridiculous sometimes. Some of these rules and regulations absolutely make no sense. But in order for us to change those rules and regulations, we may have to get out of our own way first in order for us to change those ridiculous rules and regulations. So my doctor said to me, I'm very proud of you because you pushed us to help you. Because I stayed on the phone. I stayed on the phone and I made those people give me some help. That's one of the barriers. We need to look at ourselves and make sure we have a right, understand, not make sure, we need to understand that we have a right to this health care. It's our right.
Right.
That's the first thing that has to happen. It is our right. We have to demand it. The first thing that people are going to say is no. We can't take no for an answer. I've seen it in the emergency rooms I work at. I've seen it in doctors' offices. I've seen it all over the place. They're going to put a brick wall up. We need to teach people, don't take no for an answer. Knock down that brick wall and keep going.
Thank you for your response, Dr. Cobb. I will pose the same question to you, Dr. Harrison. What are some challenges in the provision of equitable preventive healthcare services?
Well, that is Dr. Cobb has said, a lot of it is us, but we don't know what we don't know. And there needs to be people out there to advocate for us. And as a person I've been advocating for people since I was a little girl. So I really good about what he's saying, kicking down the walls and going, that's not what's going to happen. We're going to do something different. Perfect example. I remember when my daughter was she was a mom and she was having issues in her pregnancy. And, she would apologize, Mom, I'm sorry. We'd end up in the emergency room, like it seems like every day or every other day They go in and say she's okay. And then I think she felt, I was frustrated. I wasn't. I was there to help save her simply because I'd had a mom who worked for me who had a young daughter, 18, went into the hospital to give birth. And she got a phone call from her daughter, Mom, I'm not feeling good, but I can't get anyone to come see about me. Needless to say, the young lady ended up dying. By the time her family got to the hospital, some crazy stuff had gone on, but she had alerted them to that, and it shook me. My daughter was still a teenager. It's that very instance of having to walk with that mom and sit at her funeral, at her child's funeral, and hear stuff, and then find out some crazy stuff was going on. I kept saying to myself and to my daughter and to the hospital, "You're not going to kill my daughter in here." So I learned very early on to advocate. But the crazy and the great part of that was when she was frustrated one night, she was telling the nurse, "Hey, I know y'all tired of seeing me." And it was a white nurse, and she said, "What you always will do is you will say, I'm supposed to be here to get the care that I need. And that's okay to do that." And I was proud of her. I was proud of the lady who talked to her and told her, never forget that. You ask for what you want. You come through here no matter how many times you have to, and you get the care that you need. Fast forward. However, with this, the challenges are what we're facing today. That was, I think, it was like 16 years ago, or whatever. But the challenge, almost 17 today, is that there are conflicts that arise when stakeholders and policymakers begin to implement programs that have not been approached from the perspective of improving healthcare quality and access of being available for everyone. So, with that being said, providing equitable preventative healthcare services involves sharing information and resources, as Dr. Cobb has said, so that everyone has a voice and a seat at the table. That part has been missing because a lot of times, as he said, we don't know that we deserve to be at the table. We don't know that we deserve to have these healthcare services.
That's
And
right.
myself, I am here to tell you that not on my watch. Whatever I can do, as long as I'm breathing, I'm going to help. But I'm also listening to my cohorts. I'm also sitting at the table of one of a spectacular health equity person who's been saying it for a very long time. And I'm being tutored in from every issue, air quality, food. What does health equity mean? So I am privy to that. So this subject was like on point for me from the public health perspective. But Dr. Cobb sounds like he's been in the field. I know he's been around for a long time from hearing what he's saying, introduction. So thank you, Dr. Cobb, for giving me the other side of the perspective too. I appreciate that.
Let me follow up with that for a second. Here is another one of the barriers. In 2019, a nurse, white lady, came to me, 2018. I was 400 pounds. And she said, "Come here, let me take your blood pressure." She wasn't my nurse. She was a nurse. Said, "I don't need my blood pressure taken." And she took it. It was 180 over 100. I had no idea. I was a walk-in stroke waiting to happen. And so since then, here is what I've learned. We don't know our numbers. That's one of the huge barriers. We have to take control of our own health care. We can't wait for an institution or somebody else. We have to know our own numbers. I see it in the emergency room all the time. People come in, they have no idea what their numbers were. Know your blood pressure numbers. Know know your weight numbers. Know your cholesterol numbers. Know your numbers. Know your primary care physician number. Know your numbers. We have to know those numbers. Then you can do something about it. Know your state representative number. Know who to call when you need something. Know your numbers. That's a huge barrier. If you don't have the resources, you can't do a thing.
Absolutely. If you don't know where to get those resources, it won't help you either.
That's
Thank you.
absolutely
Thank you
right.
for letting me interject that, gentlemen. Thank you.
Yes, I love these conversations about, advocacy, having a seat at the table, how far we've come. And I believe we have a question from one of the viewers. And they state very passionately statements, Dr. Cobb, what are the responsible steps for those of color that have access and voice to advocate and empower those that do not?
Amen.
Great question. Here are some things that you can do. Talk to your people. Teach them about what I just said, how to empower themselves. I want you to activate them. I want you to be a leader for them, inspire them, fire them up, teach them to help themselves. So teach them about their numbers, teach them about the resources in their own community. Show them that there are resources right in their own neighborhood. Have them to have you as a resource. They need to know that they have somebody to come to right in their own neighborhood. So if they know there's an anchor right there, if there's somebody in their neighborhood they can go to right there, then they can feel safe. They need a sacred space in their own neighborhood. One of my favorite singers, India Ari, wrote a song called Sacred Space. It's a beautiful song. One of the greatest problems right now is people don't feel safe. They need somebody to anchor to. Give them that sacred space and then help them to know that they have the power to make a move. So that's the first thing that needs to happen. They need to know they have somebody to go to help them to be empowered. So we want to activate them, activate their power, give them the courage to move forward in these steps. It might take a while, but we can activate people. That's what Dr. King did during the civil rights movement. We need to start doing that again. I hope that makes sense.
Yes, yes, it does. And I'd
Thank
also welcome Dr. Harrison to join in on this question as well. What are the responsible steps for those of color that have access and voice to advocate and empower those that do not?
Um, Always have a listening ear. I believe it's very important. Learning something recently and always knowing it, but if we're so quick, people are coming to us and talking to us, and a lot of times you'll say, "How are you doing today?" But because you're in your own stuff, you really don't care to find out what that person is really going through. And if that person says, "Oh, well," if they feel safe and they feel vulnerable enough to say, "I'm not doing too good today," in the world we live in, that it may be a good thing to stop and go, oh, tell yourself you've got a few moments to listen, and then decide once you've listened to at least a little bit of what they're going through, to find out if there's any way that you can help. Is there someone that you can refer them to? I'll use that example. We have something I'd never seen before in my life, but I know it now. People having a lot of mental health issues. So our team has come up, our local government and everything has come up with liaisons, or a liaison for, we have one, a behavioral health navigator, and that person, we hear what people are saying when we're out in the field, community engagement or whatever, and then we go and we can give that information. Is safe, asking them if that's okay. But at the end of the day, today, having the listening ear will absolutely stem some of the tide. It will help people feel like, oh, you really are. I'm an advocate for people for a lot of things, so I do that. But imagine someone who's not. Imagine a father whose son is having issues, but he doesn't know where to go. But he's saying, my son has issues. Our men are the state of them. is absolutely horrendous. So to keep him from himself from going out and killing someone, ever he's saying, my son is in the guns. My son is this. You stop and stay and listen for a minute. That's going to make all the difference in the world, because that man is going to feel hurt. He's going to have some information that he could take back. And I'm just using this as an example to begin to help his son. If he feels that I can't, okay, this person said there's some resources out there. Let me make a call. Let me look at a website. Let me see what I can do. Let me go back to that person who asked me, how was I doing today? We have to put ourselves out there sometimes, even when we don't want to. And that's something I've learned as being an advocate. So thank you for including me in that conversation.
Yes, of course. And thank you for both of your responses. We'll go back to our questions, and we're going to go ahead and start with Dr. Cobb. What are some of the barriers experienced by African Americans in receiving preventive services?
First one is flat out, unadulterated, historic racism. Barack Obama got to be president, and some people acted like we made it. Dr. King's dream and they just thought it's all over. And some of those people were Black people. They thought, hey, and it scared me to death. I thought, uh-oh, we got trouble. I knew it. I saw it coming. I told my children, this is trouble. This is big trouble. People say, you don't know what you're talking about. I said, just wait. And it's been trouble ever since. I held classes with people. I said, there's going to be a backlash. And we are seeing the backlash now. We saw it with people jumping the walls. This is the backlash. I don't understand why people didn't see this coming. I saw it coming. Racism never went away. Now it's just flat out in the open. People just are now, they are not ashamed to be racist. And that racism is even uglier. And it's been legitimized. That racism we've seen all our lives is killing more and more Black people. Flat out, unadulterated racism. Not only do I have my doctorate, I have a certification in diversity training. I try to teach people to understand how racism is still killing people. One of the greatest barriers is people's blind spots. People have huge blind spots. They don't want to see it. We don't want to deal with it. We don't want to handle it. We need to help people deal with their blind spots. How do we do that? It's called social location. We have to help people understand their social location. Where were they raised? How were they raised? Who raised them? And why were they raised that way? When we can help people deal with their personal blind spots, we can help them realize, well, maybe you are racist. And maybe it's your racism that's helping you not see that these people aren't getting the resources that they need. Now, let me give you another example. I just explained that I lost 135 pounds. I work with doctors. Do you realize, you don't realize, there are doctors who never looked at me, never even looked at me, now who are consulting me on cases. It's called fat phobia. I went from being unseen to being brilliant. There are all types of forms of discrimination, all types. I suffered from several, racism and fat phobia. Barriers exist all over the place. Those are blind spots. We have to identify them. Women suffer from them. Overweight people suffer from them. African Americans and people of color suffer from them. We have to identify these blind spots and root them out.
Yes, that was an excellent contribution, Dr. Cobb. Thank you. Dr. Harrison, same question. What are some barriers experienced by African Americans in receiving preventive services?
I'm gonna put a little twist on what Dr. Cobb just said. I was recently having a conversation with a nurse, and she shocked me. She said that she had, it's been a while, but she'd taken care of a lady who was African American who walked into our health department. We're in an area of it's a long story. Resilience Catalyst is out of George Washington University, highlighted some things that was really endemic in this, or in this area, how things are done. There's a brilliant professor here at Florida State University who did a piece called Hidden History. It's about the middle area of Florida. And I may have the title a little off, but just that documentary, people need to watch that. But just trying to bring it forward to help you understand what we really are dealing with here, right here in this zip code or in this area that I live in. But the lady astounded me when she said Black woman came in, little kid, to get screening services for vaccines or whatever little kids do. They do bring the kids in for. And with her being the Black nurse, the only Black nurse on board, she was the Black lady said, "I don't want that nigger taking care of me and my baby."
There you go.
So here you looking at, here's a Black woman who is in need of service, her children in need of service, but she's looking at a person who she showed up looking like, you show up, I'm here to help you, I look like you, but you tell the white administrator or head nurse or whatever, I don't want that person taking care of me. Now, for so many years, we've gone to get health care or be a professional and have white people come in and say, "Hey, I want that nigger taking care of me." So she blew me away when she said, "Yeah." I said, "She was what?" She was like, "She's African American." And she just flat out said, she called the white people in and said, "Listen, she's not touching my baby." Long story short, they go on, the woman raises the kids. Long story short, the woman dies. And she only wanted this nigger to do her eulogy or whatever. So hearing and seeing little tidbits of things like that couldn't have only been the instance of that happening. That's ignorance to me, in that it shouldn't matter what color I am when I show up. Now, it's good that if you show up as a patient and I'm here and I can help you, that's a good thing, because you should feel like, okay, I'm in a good, safe space. But we are just having so many different perspectives and the experiences, the barriers. Sometimes we create our own barriers as African Americans, because we are falling into that in this area, old South mentality. And on top of that, trying to get people to change their perspectives and saying, we're here, we're trying to help you. It doesn't seem to be a brick wall that we can break through. So it's all of our responsibilities. Healthcare providers have to be competent. They have to begin to think that we've done some stuff here that was not in the best interest of the minorities, and especially African Americans with the highest rates of everything. Something has to change, and we have to look at things from a health equity lens. Yes, we will have to explain that to some people. They won't understand what that means. But what we also have to do is human services. That's a whole nother area besides public health and healthcare. We have to bring those people to the table so that they can begin to systematically, the systems that were built, research shows they weren't built for us. As I was doing my dissertation in intimate partner violence, and looking at the different platforms and trying to understand what the different nationalities were going through, what I understood and learned was that all of the different companies or the different nonprofits or anything that you want to say would be there to help human beings were not built for people of color. If I wanted to, in my research, I'm a woman, I show up, I'm a white woman, that man ain't hitting me in my head and beating me no more, I ain't putting up with it, lock him up. That whole system was set up. But a Black woman can say, hey, somebody's knocking me in my head. They're not even coming to my house to check and see whether I'm dead or alive. And oh, God forbid, if a Black man decides that he's going to be brave enough to tell somebody's wife or girlfriend or significant other beating the hell out of him, what? They're going to be least likely to tell us anything. And we don't have the research based on what I know. We don't have the research right now today to begin to delve into what the heck is going on with this. So there's all kind of barriers out there. I just keep going. Give me some more time. We can name them. Dr. Cobb and I can do that. So go ahead. I'm sorry. Thank you for letting me have my spill on that one.
No worries at all. I'm enjoying this conversation and, talking about, historical implications, the outright, racism in the field. I feel like that contributes to, the amount of trust that our community has within, healthcare services and, having that be a barrier of like, can I trust, these professionals to actually take care of me and, to be on my side? I feel like that constantly is a barrier of, do I trust this person? And so I love those responses that you all provided. And so I'm going to move on to our next question here. This one, we're going to start out with Dr. Cobb. We're going to talk about what are the effective strategies that leaders can implement to promote equitable preventive services?
Leaders need to first get re-educated themselves. Make sure they understand the current strategies. Make sure they're not working out of ancient history. Sometimes our leaders get stuck. They get stuck in stuff that's so old, they don't know what they're doing. That's the first problem. And second, once they get the current knowledge, they need to make sure they're having regular, up-to-date meetings and that they're letting people know on a regular, up-to-date basis what's the current knowledge, what the current situation is. So, like I said, we need to know what our numbers are. We need to help people with those numbers are. We need to activate people. So leaders need to be telling people how to be empowered. We need to help people with community activism. We need to be empowering people once again from the grassroots up, because this change will only come from the community. Leaders can empower people from the community up. And so leaders need to go out, continuous education. If they're not doing regular education themselves, they're wasting our time. And so they need to get themselves educated. They need to then empower the people to work with other people. And so they need to learn how to activate the community. I want those leaders to have hundreds of followers. And see, that's what's different, right? We're afraid to have the leaders to have followers, right? Instead of having them on Facebook, I want them to have them in real time. Go out and have real meetings. Go out and shake hands and go out and tell people what they want them to do and meet them face to face and give them real time information. Give them phone numbers. Tell them this is how you get this done. That's how we solve this problem. You can call this person at this number and tell them I told you to call. This is exactly what I do. So when somebody says, I don't know how to bury this person, here, you can go call Doug. Tell him I told you to call. Oh, I don't have a doctor. Here is my doctor's number. He has a mission to help Black fathers. So you transfer to my doctor. He told me to tell you to call. Oh, I need a psychiatrist. Here's my psychiatrist's number. My psychiatrist has a ministry to young Black women. Here, call this number. That's how we make the change, person to person. You know somebody, I know somebody, I will connect you with that person. That's how we get this done.
Great contribution, Dr. Cobb. Dr. Harrison, same thing. What are effective strategies that leaders can implement to promote equitable preventive services?
Okay, well, piggyback on Dr. Cobb. What he's saying is absolutely true. I've had myself recently change doctors, and the person who advocated for me, I was saying something was going on, and the person went in and talked to the doctor and said, "This person, I want you to please look into this." And I'm old school, so it's changing anything is like firing somebody. So I don't want to do that because look bad. But what's gonna? I mean, that mentality from being a little kid and authority and authority figures, I've had to learn to push back from authority. But that person advocated for me and went in several times. Like, okay, get the application. Let's see what we could do. And it's been wonderful for me because recently was told that I had a heart attack, but we don't know when. It was between the time I got COVID and earlier this year, but it showed up. And of course, that got my family's attention. Thank goodness. I just said one day, I'm not feeling very well, to my aunt. And she went, "Oh, well, you and your siblings, based on your father, all of y'all got bad hearts," or something like that. I was like, "Whoa, don't tell me that. When was I supposed to know?" But when you're disconnected, I grew up as an orphan from them. So you're disconnected. I don't know any of my medical history. I don't know any of that stuff that I need to know to be okay. And I've just been getting by. So imagine the hundreds of thousands of people who, because of us, a lot of us being disconnected from our families, and things happening, and nobody here to tell you that. The person that tells me this is not flesh and blood relative, but she was married to a member, and so she's like, "Oh yeah." So I go and I find this stuff out. I'm getting advocated for. Now I'm learning how to advocate more for myself. But from a public health perspective, community engagement is something that I've done and I've learned how to do better. And there are tools kits. University of Kansas has a community toolkit that gives you all kind of information. But the community-based participatory research, where we're having universities and organizations and they're building community health improvement plans based on, let's do things a little different. There's been a push for, we didn't call it health equity for I know in 2004 when I was studying this stuff, they didn't call it that. They called it healthcare disparities. We've come from many forward. We have more explanations, more definitions, and more things to talk about at the table now. But though engaging communities was something I learned once I graduated and got into community health. It's big. It's a big deal. And it's what we can use to help people. Now, there's an approach to what is called DEI, which is diversity, equity, and inclusion. And if we begin to look at health equity with those tools and that guidance, and that's a whole nother conversation to be had. It can't be had here altogether. That's going to change the dynamics of health equity and what that means. And like Dr. Cobb has said, we're going to get the leaders, get the community people, get the politicians, get all these people to say, we need to begin to think, because we're affecting our economy. We're affecting our families. They think because they live on the hill and that stuff trickles down on us, so to speak, that is not affecting them, but it is. It messes with their money. It messes with their family. It messes with everything.
That's right.
Things are changing. Lines are being blurred, whether they like it or not. Progressively, things are changing. We have a lot of mental health and chronic disease issues. That's in the backdrop. We're having to engage communities to, like he said, let's bring them the information, say, you have the power. Let's show you what your power is, and let's begin to change this. We can't just throw our hands up and say, oh, well, they're not going to listen to us. Oh, well, we shouldn't care. Because these are the very people's lives that are coming in and out of our circles that we need to be mindful of, because they're affecting us one way or the other. Whether they live or die, they are affecting us, and we need to begin to think from that system level.
Let me jump in on that. That's absolutely correct. And so when I marry my certification with my doctorate, You marry what needs to happen with my DEI certification, with my ministry. You put those together, you get a healthier relationship with healthcare and diversity. That's what needs to happen. We
Thank you,
need to
Doctor.
bring diversity into healthcare because historically, we know that racism in healthcare has killed the Black community. And, and COVID has brought that out more than anything else. Because
Yeah,
COVID killed more Black people than anything else. And it was because of racism.
absolutely.
Very, very powerful responses. Thank you, Dr. Cobb and Dr. Harrison. And I'd just like to remind our viewers and listeners, as you know, our guests share the intellectual property. Please give them proper credit for their contributions. And we will move on to our final two questions. And this one will be for you, Dr. Harrison. Um, what are some recommendations to continue the promotion of health equity in preventive services?
Okay, hold on a minute. I got my questions off a little bit. Okay. Um, there are a lot of things that need to be done, and I'm sure this is going to probably be crossed over with Dr. Cobb and I. For my take on it, we need to begin to have ongoing conversations. We have to continue them. We have to get the feedback from the communities. Never mind the partners, so to speak. We need that. But the people that are living in it, we need to hear their voices. We need to find out what they feel the root causes are, the disparities are, the vicarious racism, what it does to them, and how health equity can broaden the understanding and awareness of health literacy to sustain. That's a big deal. Health literacy for sustainable outcomes, simply because we've talked about health equity, but does anybody really understand what the health does? The forgive me, the average person is what I'm trying to say. Do they really, when you hear health literacy, what does that mean? Like, are you saying? I mean, some people, are you saying I'm illiterate? I mean, no. It's saying that how much of your health care, the objectives and the goals and everything, how much of that do you understand? Do you understand what, as Dr. Cobb has said, what your numbers mean? Do you understand that your blood pressure being 180, no pun intended, Dr. Cobb, but I've had one of them too, 188 over something. That's when they said, oh, you had a heart attack, didn't know it. But at the end of the day, when they get those numbers, how do they get those numbers? Who do they go to? Literacy. So understanding the definitions, there's a difference between health equity and health inequalities. How do we begin to bring that to the table where people can understand that? More orientation and discussion with patients on, I found this out from my colleague, biogenetics. Well, what's the connection to our shortened life expectancy? We can't have that conversation now, but I'm going to delve in and ask questions and know more about that and what that really means. I'm saying I learned a big thing between 2020 and today about ACEs. I didn't really understand the definition, what it meant, but ACEs and trauma and mental health, because these things are issues that have been a barrier for reaching communities who are affected by extreme poverty. I myself am a victim of all kinds of ACEs. There's an ACEs tree. You have all of these things that say up above where the tree and the limbs, and if you've ever seen the tree, the limbs are all out there, the leaves are there, but under the soil, there are things that went on under the soil as the tree grew. All these other things come with it. So I was a victim of childhood sexual abuse. I was a victim of no parents, all of these different things, homelessness. I've lived with all of that. Did I really have to work hard to try to push some of that back down in the soil so that my next generation, my children and my grandchildren, didn't have to go through? Absolutely. And I'm not the only one, but imagine the people that don't have those resources, don't know how to go get them, don't keep pushing forward because they feel hopeless. And they don't know that there's somebody out there with the resources that they need to be okay. Their mental health is their number one health and wealth. If you can't get people to be mentally competent or mentally okay, how the heck are they supposed to do anything else with their life? It's really hard. We can continue to hash this out and have these conversations, but these are things that have to happen. And I think more than anything, the push comes when you get people to understand that it's okay to have mental health issues and get some help. Well, I'm going to tell you that
Amen.
I've been in counseling for years. And somebody, oh, shh, don't say that. People gonna think you crazy. Okay, well, think I'm crazy. My children say it all the time. But at the end of the day, it rolls off of me because guess what? There's maybe something that I can say or do that's going to help somebody else going, oh, well, she went through that. She went through the crazies and she's okay. Guess what? I may be able to go get some counseling and get to the crazies too. And then maybe what I can do is begin to break that cycle for my children and for the generations to come. I'm sorry. Thank you for giving me that, but I'm going to digress and step back now so Dr. Cobb can
Let me
come
join
in
that
here.
choir. I'm in
Yeah.
counseling too. And my doctor, who's an African American male, he made me go. He said, he said,
Okay.
he said, you got no choice. You going. So I've been in
Right.
since 2019.
Okay.
I just have one or two recommendations. This is really simple. If you don't have health insurance and you can't afford it, get Obamacare.
Okay.
If you do have health insurance, it's one of the greatest lessons I've learned. Call your health insurance and find out all the resources you have. We leave resources on the table. They provide, probably you get free counseling, free coaching. They give you so much stuff. They won't tell you about it because they don't want you to use it. Call your health insurance tomorrow and ask them, especially if you have diabetes, you may get some diabetes services for free that they're not telling you about. You may be paying for stuff that you may get for free. Have your parents call and see what they can get. Your insurance may not be giving you what you deserve. Call your insurance and find out what you might be leaving on the table.
Gotcha.
Great
Thank you.
responses from both of you. Thank you. Thank you. Our last question for this evening is how has your affiliation with the Black Doctoral Network helped to enhance you personally and or professionally? And we'll go ahead and get started with Dr. Hairston.
This forum has given me the opportunity to acquire knowledge from the members and presenters, such as Dr. Cobb, and there are other doctors that talked to me and have interviewed me. And along the way, I found out about BDN probably as a student, and I was just so grateful that I had this forum and one other forum, a PhD forum. And it actually helped me get through the hard times of trying to get through my my dissertation, because I had taken all of my classes, but that was one of the hardest moments in my life that I had to figure out what to do, and to have a place to turn like BDN was really good for me. I'm grateful for the information I've attained, and it keeps me progressive. I thank all of you for the opportunity and for listening to me here today.
Thank you, Dr. Hairston. And same question for you, Dr. Cobb. How has your affiliation with the Black Doctoral Network helped to enhance you personally and or professionally?
First, professionally, it's given me a lot of resources, which I appreciate. But personally, it's filled me with enormous pride. When I say to people, I'm a member of the Black Doctoral Network, it is just prideful. This is a tremendous organization. It is something I stick my chest out and say, yes, that organization exists and I'm a member. It is a fantastic organization, and I thank God it exists.
Amen.
Great. Thank you. Thank you both, Dr. Hairston, Dr. Cobb, for joining us this evening. And before you go, we want you to share your contact information with our viewers and listeners. So Dr. Hairston, could you please let our audience know where they can go to get in touch with you?
Actually, they can email me at JM Harrison Consulting. That's JMHAIRSTONCONSULTING at gmail.com, and I will direct them to the website because I can't repeat it right now, but I can absolutely send it to them.
Great. And you can see it down below.
Okay.
And Dr. Cobb, same question. Let our audience know where they can go to get in touch with you.
I'm at two places. I'm at Willie, WILLIECOBB.com, or Willie Cobb, WCOBB3033 at gmail.com. WillieCobb.com. So
Perfect.
please feel free.
Thank you so much to both of you for joining us this
Thanks
evening.
for inviting me. I enjoyed it.
Thank
Yes.
you. I appreciate
And
being here with y'all.
Yes, yes.
Dr.
And
Harrison,
to
it
our
was fun. Thank you. I enjoyed meeting you.
Yes, it was. Thank you.
and to our listeners and viewers, thank you so much for joining us again. We welcome you to connect with the BDN on our platforms at Black PhD Network on all platforms. Thank you for joining us, and we hope to see you next time.